Hello friends, I am Dr. Hameed Ibrahim Khokar, Chief Physician and Director of Khokar Advanced Ayurveda Center for Infertility and Sexual Disorders. Recently, one of my patients consulted me for the problem of her infertility, which she was suffering from last 8 years. She has undergone 2 cycles of IVF which were not successful. So this couple was very much frustrated and worried, and they wanted to understand what Ayurveda can do in such a scenario. So she read about me and she wanted to understand what Ayurveda can do in cases of IVF failure as well as for her infertility management. Ayurveda does not speak about infertility just as a symptom. Ayurveda says infertility as a disbalance between the mind, the body as well as the soul. So let us understand one by one what all parameters we assess in one particular individual in order to come to a conclusion regarding what is the final treatment protocol which needs to be given in such a case. The most and the basic point in Ayurveda what we consider is the prakriti of that particular individual. The prakriti means the constitution of that particular individual, and Ayurveda says about 3 doshas which are Vata, Pitta and Kapha. So the 3 dosha balances and imbalances has to be assessed as the basic first line of step. The second step what we assess is the dhatu formation. Dhatu means the reproductive tissue. The reproductive tissue in the male is the sperm and in the female it is the ovum. Now Ayurveda says that this dhatu, Shukra-Dhatu, is the 7th dhatu getting formed inside our body. Therefore, there is always a problem in the formation of this Shukra-Dhatu since it is the last dhatu getting formed inside the body. So there can be Bija Dosha or Shukra-Kshaya. That means reduction in the sperm quality as well as the count and abnormalities in the ovum. The third point Ayurveda stresses is on the importance of Agni. Agni basically means our digestive system, or you can translate it as digestive fire. When we consume the food and the assimilation absorption is done of the food through the process of metabolism. Now when we consume food, the dhatu formation happens from the metabolism of the food. So whenever there is indigestion processes, whenever you are having some digestive issues, the dhatu formation gets affected, especially the last dhatu which is the Shukra-Dhatu, leading to the problems in the formation of the sperm and the egg. Ayurveda talks about the Shodhana karmas, that means purification therapies which is needed in one particular individual. So after we assess the dosha, dhatu and Agni, we decide a purification or detoxification therapy. Commonly it is called Panchakarma, or all the 5 karmas are not done in one particular individual. Depending upon the dosha, dhatu, Agni, we decide which Shodhana karma is most suitable in that particular individual pertaining to the infertility. So after the Shodhana karma, we decide to give the dravyas, means the herbs and minerals from the rasayana and vajikarna speciality of Ayurveda. So in short, first we decide the dosha, dhatu, Agni, Shodhana karmas, then we give the rasayana and vajikarna, herbs and minerals. One more important parameter Ayurveda discusses is the state of mind in that particular individual. When a person is under stress, worry, anxiety, emotional trauma, it leads to the hormonal imbalances by affecting the hypothalamus pituitary gonadal axis. Therefore, Ayurveda also gives very important to the mental well-being of that particular individual. Last 2 parameters what we assess in one individual is called as Ritucharya and Dinacharya. Dinacharya means the day-to-day activity of that particular individual, like the person's diet, lifestyle, food habits, food habituation, sleep, whether any exercise activity is done, whether he is having sedentary lifestyle, allied health conditions, diabetes, blood pressure, cholesterol, thyroid, all this has to be assessed under the heading of Dinacharya. Now, what is called as Ritucharya? Ritucharya means the seasonal variations and its impact on our body. This also has to be assessed. So, Step by step, we assess all these parameters in one particular individual. Then we decide a personalized treatment for that particular individual. So believe me friends, after analysis of this all parameters, we started medication in this particular patient, and after 6 months of medication, she conceived and she was very, very happy because she had underwent IVF which was not successful, that also 2 times, and with our treatment she was able to have pregnancy naturally. So if you are suffering from any kind of infertility issues, don't worry and don't get depressed. You can consult a qualified Ayurveda specialist in the infertility.